And fourth is perception, when how we perceive things. So first, in memory, there is always this recent memory and long-term memory. Remember, recent memory is what has happened yesterday, 2-3 days back, or a week back. Whereas long-term memory is your remote memory, which is what has happened, say, many years back when you got married, who was your first school teacher, which school you went to. So all that remote memory is long-term memory. In Alzheimer's dementia, or for that matter, any degenerative dementia, it is always and always the recent memory which goes away. We find many a times patients' relatives telling that, "Hare, the patient's memory is so fine, he remembers even his school days right now." It's not that. The old memory will always be intact because it has gone into the hard disk, which is called as the frontal lobes. Whereas the recent memory, which is the RAM of the computer, which is in the hippocampus of our brains, is the main center where your dementia affects your brain. And that's why in memory, recent memory issues is the one of the early symptoms to get affected in Alzheimer's dementia. The other domains, behavioral issues. Behavioral issues means patient can become either very dull or patient can become either very hyper. Initially, the behavior was very quiet, and now he's become very aggressive. So these behavioral changes happen. Third, as I said, perception, where you will have issues with delusions, hallucinations. So what is not there may be perceived. You may have paranoia. So your relative is coming to give you something like water, but you may think that this is something else, and you may perceive it as a threat. So all these problems can happen in patients with dementia. So that's why when a person gets dementia, Alzheimer's, it creates two victims. First, the patient himself or herself, and second, the caretaker, who, as a patient's dementia worsens, his symptoms may also worsen if he has not learned how to handle patients with dementia. So by the second point, I mean that caretaker burnout. So any caretaker who's taking care of a patient with dementia knows this perfectly, that it is very difficult to handle. When a patient with dementia is diagnosed, the whole family, in fact, gets affected because things are all haywire now and they are constantly on their toes and things don't seem to get solved. In fact, just get worsening. So if you're not in the right state of your mind, you don't know how to handle things, you are yourself going, as a caretaker, going to get crazy. And this is very common. So I hope in this lecture, if we are able to minimize that. Okay, so myths in dementias. These are just broad terms, and I would like to discuss all these topics. Dementia is a disease of the old. Now, is this correct? So this is half correct and half wrong. So even though yes, it's a neurodegenerative condition, so it will happen to elderly as the age advances. But even though it is presented in the elderly, the disease has actually started many years prior the actual presentation. So if the presentation has started at the age of 70 years, the disease has actually started in brain at the age of 40 years. So from four decades onwards, the condition starts progressing. And if you don't kind of intervene at this place after 40 years, then it is going to be a downhill course and the dementia presentation is going to happen. Science is growing and we may have a cure by the time we become old and get dementia. So technology is advancing, there's no doubt, in a very fast pace. And we do know the way things are happening, the way research in dementia is happening. In fact, in US, maximum research is happening on the, if any medical condition, so it is dementia right now, because more and more people are going. Um, so yes, if I'm 40 now, probably at the age of 70, there may be a cure. So is this true? Unfortunately, this may not be true. And now, in fact, the science is shifting from rather than cure to focus more on prevention. So why is this? Because the time we diagnose dementia, already the process has advanced so much in your brain that it becomes very much difficult for us to reverse it, and that's why it's difficult to cure. If we could tap the condition when it is getting worsened at the age of 50, at the age of 45, that time it can be halted at least, or it can be reversed. But when it has progressed to an extent where the symptoms have started coming, in terms of percentage, already 80% of the damage has been done. Okay. And when the patients have started to become dependent for day-to-day activities, the damage is almost more than 90%. Next, dementia can be cured with present medicines, or at least we can prevent the worsening. So yes, this is also wrong. At present, we don't have any medicine which can cure, whether it is allopathy, whether it is Ayurveda, whether it is homeopathy. People may tell, for the simple reason I said in the just prior point, that the advancement of the condition is so much that we can give medicines to make them feel better and comfortable. But are we able to cure the condition from the baseline? Unfortunately, no, and it will be difficult. And in spite of so many researches, now we have come to the conclusion, at least, that it may not be able to cure, but at least we may be able to prevent. Do we have any medicines as of now to prevent? So the answer to this is also no. There are no medicines to prevent the worsening as of now. So next point comes, dementia can't be prevented if genetic background is present. So this question many a times we ask, my mom and dad both had dementia. So I think I have a genetic background. So I don't think I can do anything to prevent it. So this statement is also completely wrong, because dementia can be prevented. Though it cannot be cured, definitely it can be prevented, and more so if there's a genetic background. So how to understand this point is that if you have a genetic background, if you have the gene, so there's the ApoE gene which has been found to be the culprit in dementia patients. It is seen, first of all, that 50% of the patients who have this gene never get dementia. Second, interestingly, it was also seen that in US, when this gene was found, most of them got dementia. But when the same gene was found in people of Eastern Africa, the risk of patients getting dementia was less than 10%, whereas in US, the risk of patients getting dementia was 90%. The conclusion, what I'm trying to say over here is, it is the environmental factors which rule and will decide whether you will get the symptoms or not. So in simple words, the genetic background is like loading a gun, but what actually pulls the trigger is your environmental risk. So modifying these environmental risks is the way to prevent one from getting Alzheimer's dementia. So that's what we will try to discuss in this topic. Last point, dementia means Alzheimer's. They are one and the same. So I think I've just said that. Dementia, Alzheimer's are not the same. In fact, dementia is a big group of condition in which Alzheimer's dementia is one of the most common causes of dementia. Okay. So what are the other types of dementia which we know? So there is frontotemporal dementia. There is Lewy body disease dementia. So I think the famous actor Bruce Willis had FTD, frontotemporal dementia, and Alzheimer's dementia, I think, is the most common cause of form of dementia. In Alzheimer's dementia, your main symptoms to begin with and the main domain to be affected is the memory, recent memory. Whereas in FTD or frontotemporal dementia, which is the second most common type, the most common domain to be affected in cognition is the behavior. In fact, the behavior becomes inappropriate. There's a change in behavior, and the memory is surprisingly normal till the end. Okay, so what can be done to prevent one from getting Alzheimer's? So you have to understand what exactly happens in Alzheimer's dementia. So this what we are going to talk is mainly about Alzheimer's now. So there are these three mechanisms. As we age, as we think, multiple thought processes happen, multiple connections happen. Whenever you learn something, whenever you see something, you learn something, you process something, a connection is formed in the brain. And there are multiple such connections which are formed in our brain throughout in a day. When you sleep in the night, the brain does the job in your REM sleep to filter the unnecessary things. What is not needed is scrapped out. What is needed is kept. So that's why the sleep is important, where the kachra accumulated in the brain in the form of toxins has to be cleared up. So it has been noticed that the clearing process in the brain of patients with Alzheimer's is not happening properly. Over the period, these we call it as NFTs, neurofibrillary tangles, which are the toxins which keep getting accumulated as the connections increase, and these toxins are not cleared off properly in their sleep, and that's why they induce a chemical inflammatory reaction in the brain, which starts shrinking the hippocampi, which is the RAM center in the brain first, and that's how the brain damage happens over the period, starting from 40 years onwards, and then slowly it progresses. So that is first mechanism to reduce toxin damage accumulating in our brains throughout the life. Second is by improving your circulation. Simple. So there are these toxins which are accumulated. You need a good REM sleep so that the clearance happens. Obviously, you need a good circulation to the brain so that these toxins are clear. So anything that will improve your circulation will help you. Third is to improve brain reserve. Now, improve brain reserve means to make strong connections. Unfortunately, as we see the technology advancing, we are seeing multiple things which are not good for the healthy brain. So one thing is there are too many distractions. There are too many unnecessary things which our brain is pushed to, too much information. And all these connections kind of get piled up and then they are cleared up. Obviously, the toxins will be increasing and they have to be cleared up in a good night's sleep. And unfortunately, the good night's sleep is also affected because many people keep watching phones, and the blue light in the phones helps them not to sleep early. So all this chaos is happening. Again, we have to wake up early in the morning. Many elderlies have this problem of waking up in the night to go to the washroom multiple times. So the uninterrupted good sleep which has to happen to get an REM good sleep doesn't happen. The clearance doesn't happen. So to improve the brain reserve, we want good, strong connections. And we'll go to the next slides where we'll come to know which connections are good and which connections are bad, in the sense, what will help to improve your brain reserve. Okay, so now these are kind of small points that will help to understand what we can do. And believe me, eventually, after so much research, so many medicines, so many FDA approvals for medicines, then coming for, then journals saying for, and then kind of them getting rejected. Eventually, these are the points which actually matters. The first slide which I mentioned, those three things. So to reduce the toxin damage accumulating in our brains, you need a good night's sleep. To improve circulation, you need to have a good exercise regime. To improve brain reserves, you have to learn every day something new and strengthen those connections. So you have to keep learning, keep reproducing, keep teaching something so that your connections get strong and the brain reserve gets stronger. Will certain foods help? We'll come to that. So in certain foods, the logic is simple. Usually fruits, foods which have antioxidants, which have this scavenging action of the radicals which are formed along with the toxins to to cause the inflammation in the brain. Those antioxidants will help to kind of remove the scavenging action. And those fruits are usually anything which are rich in antioxidants. So vitamin E, vitamin C, then salmon, fish, omega-3 fatty acids, all these fruits which are rich in this will help you. Walnuts. But understand the point that only foods without any exercise, without any sleep is not going to work. Okay, now going to more practicality, where how we can help science to prevent us from getting Alzheimer's. So one thing, first, have a purpose. Now, I'm not sure whether you have experienced with your relatives or friends nearby, where I've seen frequently that there's a wife and she's taking care of her ailing husband, and she has that as the main priority, and everything of her life revolves around her husband's care. Then suddenly, the husband expires, and there's a big vacuum in the life of the wife. And now what? And then suddenly, as if the whole purpose of life is not there, and then suddenly all diseases start coming. And you can see they are all neurodegenerative diseases. They may be Parkinson's, they may be motor neuron disease, they may be dementia. So all these degenerative conditions start, at least neurologically, can enter or can start coming. So have a purpose. Join club organizations that need volunteering. If you start now, you won't feel lost and unneeded after you retire. So that's the importance of early intervention, where if you have, you're going to retire at certain age. If you don't have a plan what you're going to do, things may not be good for you. In the sense, if you just decide that I'm going to, so the kids always tell the parents that now it's your time to relax and not do anything. So I am totally against it, where I think unless and until you don't have a purpose, things may not turn out to be good. You should have a plan where you have to kind of do things which you like, make a list and try to perceive those things. So that's what I mean by the first point. So you have to join club organizations that need volunteering and help people if you can in whatever you like to do. Second is developing a hobby. We will build new connections as you're trying to do something new and complex. So yes, so developing a hobby is kind of a sub point for the first point itself. So as simple as gardening is one hobby which you can kind of do. Is in our society as well, there are many elderlies who have started building trees, growing trees here and there, and that on a big scale they are taking it as a good hobby, which not only helps the society but also kind of helps your brain. By Because you're trying something new, you're engaging in socializing, and believe me, all these points, socializing, doing something new, learning something new how to do, and then practicing it, all these are building strong connections which are healthy, and that will help, and that no medicine is going to do. Next is practice writing with your other hand. So yeah, if you're a right-handed, then you have to practice writing with your non-dominant hand. So this is a simple exercise, which is something difficult. So go out of your, basically what we want to say here is go out of your comfort zone. Only when you go out of your comfort zone and try to do something challenging, will your brain be challenged and will try to modify. If it is the same thing happening again and again, the brain is not going to grow. Taking dance lessons. So dance lessons, why? Because then again, there are like, people keep saying dancing, exercise. So is that these simple things inculcate so many other neurophysiological things which will actually help. So like dancing is a kind of a physical activity which I know is going to increase the circulation, as you mentioned in that point. It is also a kind of socializing which is going to make you converse, make you interact, which is also going to help to make connections. Learning the steps and practicing it is also going to help the brain reserve by making new connections, healthy connections. So all 3 points, 4 points which we discussed in the first slide are covered by just simple dancing lessons. And obviously it is an enjoyment also. So walking daily, 10K steps a day. This is one more thing where basically, as I said, exercise. So any exercise, will weights and all that help? No, it is basically cardio, aerobic activity, walking, running, cycling, swimming, all these things, dancing are activities which increases your heart rate, keeps you moving around, and that helps in the brain circulation. So the more you move, the more happy your brain is. And the moment your movement reduces because of any reason, then your brain starts worsening fast. So as we have all experienced in the COVID lockdown, that many patients with dementias who would have otherwise presented to us after maybe 5 to 10 years later started presenting to us after 2 years of the lockdown. And suddenly there was this big kind of a small endemic of dementia also, which each of us neurologists were seeing. And the reason being not that the COVID itself was causing these symptoms, but it was the lockdown which had stopped the mobility of these elderly patients who were anyways on the brink, who would have otherwise developed after 5 years, started to come earlier. So that's about walking. Then getting a good uninterrupted sleep. So yeah, so uninterrupted sleep is the thing which is important to get a good REM sleep. So I'll just tell you the types of sleep, basically NREM sleep and REM sleep. Non-rapid eye movement sleep is the sleep in which you go into once you go to sleep. So the first half of your sleep. And REM sleep, which is a rapid eye movement sleep. You may, if you have kids in your house, if you see them sleeping, you can see their eyeball tuck, 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 moving rapidly when they are in sleep, especially in the morning when you have woken up. So the REM sleep is the sleep where you are dreaming. It's the dreamy state. NREM state also has dreams, but we never remember. REM sleep dreams can be remembered. And it is the REM sleep where the brain is actually functioning fast and the main clearing process is happening. The later half of the sleep is the REM sleep. And when you go into sleep, you go into an NREM. And when you wake up, you always wake up in a REM sleep. So the more your REM sleep is there, the better it is for your brain. Read and write daily. Writing what you read or explain it to someone and not copying. So what I mean by this is that make a point now onwards only that you read or write every day something or the other. So a day gone, and it should not be the newspaper itself. There should be something else which you have. Unfortunately, the technology, the videos and all are so much that we end up not reading nowadays. But make a point that you read, and whatever you have read, that you can write. Now, if you have a difficulty in writing or something because of arthritis or whatever in the elderly, then you have to explain to someone what you have read. So it's like you read and you write the same thing what you have read, so that you are strengthening the connection. And if you can't write, you at least explain it to someone as if you're teaching something. So I always tell that you can always read some book which is not just a story, but you can summarize it and then write it on that day. If you have read 4 pages or 10 pages, you can just summarize what you read from that and tell it to someone. That's the best way of an exercise to increase the brain reserve. You can start knitting. It is a productive job. You can learn a new language. So learning a new language is they say by science, is the best way to build good connections and to increase the brain reserve. So all this, if you start at the age of maybe 55, 50 or 40, then it will make sense in later on. If you try to do this at a very elderly age, it will be a little difficult. This has to be started early. But nevertheless, before you develop the symptoms of dementia, if you start this, it will still make sense. Learning a musical instrument is the second next thing which comes after learning a new language in improving your brain reserve. Playing board games like Scrabble, learning something new, take classes. So all these points are to just increase your brain reserve. And the more you learn, the more the brain reserve improves. Now, meditate or be mindful. Learn to shut off the unnecessary stuff and stresses of daily life. So everybody says meditate, be mindful, and how. So now we do know how meditation or mindfulness actually helps in preventing Alzheimer's also, because it helps you to focus and it helps you to say no to other things. And you must, if those who practice meditate, you know, it's not that you say no to other distractions. It's just that you allow them to come and go. You don't sit on them and go on a ride on those distractive thoughts. So that's what you learn to ignore them, and that's how the kachra in your brain can be reduced, and that's how the toxins accumulating because of that kachra can be reduced. And I think, as we saw, that that's one of the prime things which will actually damage your brain later on. So meditation at this age will help you to clear the toxins also better. In fact, the toxins won't be formed. So now I think we'll come to the next important thing, which is caregiver burden. So caring for loved ones with dementia is challenging and stressful for family members who have to provide the home care. The responsibility takes a huge physical, emotional, and financial burden on the caregivers, which is known as the caregiver burden. The survival and quality of life of the dementia patients have been shown to be related to the well-being of the caregiver. So just like a child in your house, if you're, as they say, if the parent is healthy and well, the child will also be healthy and well. Similarly, if the caregiver over here is well, the quality of life of the dementia patients and the care will also be given properly and will be good. So when you an overwhelmed caregiver can result in premature institutionalization and increased healthcare utilization. Means when your caregiver is not informed or not trained well to how to handle such patients of dementias, unfortunately, the dementia patients will keep getting admitted for small things, and there will be a lot of financial burden which will increase. And not only the admission will happen for the patient of dementia, but also admissions can increase for the caregiver himself. Or OPD follow-ups, we are known to increase for the caregiver because of the stress which they cannot handle. So the physicians, doctors, local GPs should assess caregivers for the level of perceived burden, presence of any depression and anxiety, social support, behavioral problems in the care recipients, and coping strategies help the patients and caregivers. So how do we go about reducing the caregiver burnout? So to all these caregivers, we usually tell them to join some support groups where the support group is not for the dementia patients so much, but it's also for the caregivers themselves, because they discuss how the someone similar to them is facing a similar problem and how things are handled, and then there is a sense of kind of a support and a well-being which they can perceive. So first thing is you have to understand how these patients think, and remember that they will not remember anything that you have said, even if it is 10 times. What I mean by this is that if the caregiver understands how a patient with dementia thinks, he will know how to handle these patients properly. Same thing in a house where there are children. If you know how children think, if you know why the child is getting angry, you will know how to handle them properly. In dementia patients, they may be worse than children, because children, at least once, twice you are told, they may listen. Here, they don't remember whatever you have told. So, it's very common where the relative or the caregiver keeps telling them the same things and keeps getting frustrated. But there's no point in getting frustrated, because whatever you have told, even though it is 10 times, it is not going to register in the brain of that dementia patient, because he doesn't make any recent memory, period. So arguing with this patient is pointless, because understand that these patients are not doing it on purpose. The problem, if I have to explain by the caregiver's point of view, is that there are fluctuations in patients with dementia. Means that at times the patient may behave in a perfectly sane way, and sometimes the same patient in the same sitting may give a completely wrong, may behave in a completely wrong way, or may forget that which initially he had remembered. So then the confusion happens in the caregiver, where why this patient is behaving once correctly and once so wrongly. Is it doing so to just to bother me? And this, or probably this is some kind of an acting or a drama. So this is what goes into the mind of the caregiver, and that keeps increasing the frustration. So it's a simple knowledge of knowing that these patients fluctuate. At times when they are stressed, their cognition will be worse. At times when they are happy in their comfort zone, their cognition will be better. So these are some parameters which we can predict when the patient will perform better in cognitive tests and sometimes not perform good. So that's something which caretaker should know. They fluctuate. Second thing, they should know that arguing with such patients is pointless. More you argue, the patient is not going to make any progress in that. It's you who are going to worsen because of the frustration which keeps increasing. So the another thing which you should remember is that use mirroring, dancing, music as forms of communication. So because you know that talking to them, patients may not make sense, in the sense that you will not remember. So uh, so what they say is, if you want to communicate and build a rapport with a patient with dementia, use these three things. And these three things are something which they find it good, and you can build a good rapport with them. So use mirroring. Mirroring means what you do, same thing they will copy. So if you want to laugh, you want to make faces, something which is childish, but you do that, they will also do the same thing, and you can kind of both start laughing for no reason actually. But that kind of is important to build a rapport, and then you will see things just melting away between you two. So mirroring. Second is dancing. Um, so so these things, wherever you get a chance to initiate dancing or something, will actually elevate the mood of the whole family. And that's so what we will be most of the time, we see the whole family mood kind of going down and down. Here these things, simple things you remember, can just keep elevating the mood of the whole family. Similarly with music, making communication or talking something in their favorite musical tone can help. Having, or when you come to meet a patient with dementia, rather than talking, just playing the favorite music can just change the mood. Okay, because talking points doesn't make sense, they will forget. You can show them old photos, and so you do know that the recent memory is gone. Talking about recent things may make no sense, but you show old photographs, they will remember the old photographs, and then you can make any stories. They may not be true, but you can just keep talking, and then you will see the same stories talking coming from their side. So that's how, if you want to generate a communication with them, it has to be got to do with remote memory. Thank you. So if any questions, please ask me.
Thank you very much, Doctor. Thank you very much. A very detailed and an excellent presentation. Can I get to the questions directly?
Yeah.
So I'll just put off the screen share. Can you put off the screen share, Doctor?
I'll stop it. Yeah.
All right, Doctor, we have a question from Mr. K. Durga Prasad Rao, who is 71. Says, DM since 25 years, had stent in December 22. Since a year, I forget even instances I have joined few hours back, be it names, places, etc. Sometimes even the lanes and by-lanes where I reside. Kindly advise, Doctor, presently on medication, including insulin 10 units at night.
Okay. So mainly he forgets recent memories, right? Yeah. So first thing, when you go to a neurologist with these complaints, they will rule out reversible causes, and we will give you some blood tests to be done. We will ask you questions like whether you have urinary incontinence, mainly in the form of urge incontinence. Means when you have to pass urine, you have to go. If you don't go, then some urine will leak in your clothes. If these symptoms are there, then an imaging is also needed in the form of a CT scan of the brain, and along with some basic blood tests like serum B12, D3, TSH, CRP, electrolytes, and urine routine. This is a standard kind of a protocol blood test which we do to rule out reversible causes, and then we can take it from there.
Thank you. We have a question from Mr. Sumechan Jain, who's 81. Says, for continuous sleep of 6 to 7 hours, I have to take Alprex 0.25. Otherwise, I can't sleep well. My diet consists of good amount of fruits and vegetables. I do some exercises and go for a good walk of more than 5,000 steps daily. I have a very, very poor memory. I have to think a lot for what I did a week back. I do. He does Sudoku and Kakuro. He doesn't have a specific question, but
okay. So I'll answer to that. Yeah. Basically, see, I'll tell you one thing, that this walking for 10 kilometers is supposed to be daily a recommendation for a healthy brain for males, and 8 kilometers for females. Now this 10 kilometers, even I don't know. So I mean, it's too much. But this is what is actually needed. In that, this 5,000, 10,000 steps at least, which is practical, we should at least do. So 5,000 steps also, I want to say, is less. The more you walk, the better it is, one. Second is Sudoku and all these things which challenge you, the mental puzzles. As I said, what actually will matter is those 3-4 points which I said to keep your brain healthy. The memory you're taking alprazolam for your sleep. So there are some things called as sleep hygiene, where you have to follow those sleep hygiene issues. And if still you're following that and still you're not getting sleep, then I guess it's okay to take Alprax. About Alprax, there's one thing which we call as you develop tolerance. Tolerance means if you have been taking it more than 6 months, now even if your sleep issue has been solved, you cannot keep the Alprax down because you have kind of got used to it. And if you don't take Alprax, even though it is not working, still you will feel restless. So probably the Alprax may be difficult to stop if you're taking for a long time.
Right. Doctor, a few basic questions. One is from SC Koti. Is forgetting what one has kept something recently and often, is it a sign of dementia?
Yeah, so this I didn't touch actually. Forgetfulness and dementia and Alzheimer's are all three different things. Forgetfulness of recent memory happening again and again without even when the visual cues are given, and still you don't recall, then we can tell you that this is going into cognitive impairment, something for dementia. So what I mean by this is that, say I give an example where I check my phone, there's a report which has been sent, and I have to inform this report to my senior on an urgent basis. Now, so I keep reading that report and now I have to forward it, but then suddenly there's a phone call which comes. And then that phone call tells me that have you, then I keep talking on that phone call, and then they say, "Ki just check out this new update," and a Facebook update comes, and email comes, and all these seem to be little important for me. And then I keep getting distracted to all this. And then what was the first reason for which I picked up the phone goes away. And so I don't send the important, and then my boss calls and he says, "Why didn't you send?" And so and so. Then I say, "Ki, why I did? How can I forget all these things?" So the brain has the hippocampus, which can at a given time store 5 to 6 important things. If you cross those 5 to 6 things, then they will be overlapped and replaced. So if you have in the hippocampus 5 things ready to be done on a particular time, you will be able to do. But unfortunately, in today's world, there are so many distractions which are happening, especially because of the phone, that and this fast-paced technological world, that these 5 things keep replacing, and whatever for which you had started to do, that kind of gets replaced and you forget. So what another word for this is inattention. So you cannot pay proper attention to it, and that's why you forget. So to improve your attention, improving your attention can improve your recent memory also, and which is not dementia related, which is just attention related, and for which you will have to kind of learn to focus and not fly away with the distractions, for which I think mindfulness will help you. In dementia, what happens? So in a normal patient, when the phone call, he kept the phone and he forgot totally. Then he went to the washroom and again saw the phone, and then he will remember, "Arey, I have to send a report." So that was behaved, the phone, seeing the phone behaved as a visual cue, and that helped him to recall the memory. In dementia, that doesn't happen. So he goes to the washroom and sees the phone, but he will not remember that there was a report to be sent even after the visual cue. So that's the difference between dementia patients and memory patients. Most of the times it is not dementia, but it is just inattention because of too many distractions.
Doctor, we are gradually running out of time, but I'll just ask a few questions. One is from Madhusudan Bhandarkar. He says his brother-in-law is 78 in Chennai, seems to be suffering from Alzheimer's. He has good appetite, sometimes recognizes people, but doesn't come out of the house for the last 3 years. My sister is abused by him with bad language. Is there any cure? Please advise.
So we just discussed, no, there's no cure for Alzheimer's.
Right. We have a question from Katie Dadanchi. Doctor, if my B12 level is 83, when normal range should be 180 to 915, will I get dementia? She is 72.
No, you should be lucky then. The B12 is low, and that is a very common cause of nutritional deficiency, forgetfulness. So you should, and it's very easy to correct it. So you correct it, and that is no way near to a risk factor for dementia.
Right. We have a question from Mr. Ajay Khetarpal, who says his grandmother is 82 years old. She remembers long-term events and many short-term events too. No behavioral issues. MRI brain shows global cortical atrophy. Could this account for her mild cognitive impairment, not knowing years, age, months, without a dementia diagnosis?
So global cortical atrophy is seen in most of the elderly people at the age of 82, which is normal. So I would say ignore it. But MCI, mild cognitive impairment, is a condition which is a precursor for Alzheimer's dementia. 50% of patients with MCI, mild cognitive impairment, will go to form Alzheimer's dementia. So I think if you have a doubt, you should meet a neurologist, let them assess, and then they will kind of take a decision what is the best plan.
Right. Uh, we have a question from an anonymous attendee who's female 77. She has sleep problems at night. Does afternoon sleep compensate or make night sleep impossible? Is because she says the afternoon sleep is deep.
So according to the research, afternoon sleep of 26 minutes minimum, around 26 minutes, is healthy. But if you go more than 2 hours or so, that may not be so healthy. So as I said, uninterrupted night sleep, where it is more than 5 to 6 hours at least, is more important than your afternoon. So 4 hours of night sleep and 4 hours of afternoon sleep is not good. Rather 6 hours, 7 hours of night sleep and 1 hour of or maybe half an hour of afternoon sleep is a good better choice.
Right. Thank you. One last question we have is REM sleep 60 minutes. Is it good?
REM sleep of 60 minutes, is it good?
Yeah.
That's an interesting question because nobody can count your REM sleep. How will you know? So we can't count.
Okay. Doctor, we have a question from Dr. Sarla Barad. It's in Hindi. मेरे नजदीक के रिश्तेदार पुरुष की उम्र 76 साल है. उनकी माताजी एक बड़े भाई एवं बड़े भाई को अल्जाइमर्स था. अब उनकी तकलीफें में पेश संग करना, पानी का नल संग करना भूल जाते हैं और किसी का नाम भूल जाते हैं, अपना मोबाइल कहीं पर भूल जाते हैं, फिर 12. I'm sorry, I can't read the rest.
Yeah, so what she's trying to say is he is showing signs of early dementia and basically forgetfulness and at an elderly age. So here you have to assess for Alzheimer's dementia. And I think big mistakes can happen sometimes with these patients. They can switch the iron on, switch the geyser on and forget. And then many financial errors happen, robbery happens in such patients. People get lost at night, especially they they forget their address. So I think a neuro consult for this patient is needed.
Absolutely. Thank you very much, doctor. As always, our advice is those of you who do have somebody who is showing some signs of dementia, or if you have any doubt to check, do consult a medical doctor for this and do not hesitate. Sessions like these are advisory in nature. Of course, you can get in touch with Dr. Kaustubh Mahajan at the SL Raheja Hospital in Mumbai. And somebody has asked you for your contact details, doctor. So shall we just ask them to contact you at the SL Raheja Hospital?
Yeah, they can contact Raheja Hospital.
Yeah, the SL Raheja Hospital, which is a Fortis associate. You can, that's at Mahim in Mumbai. You can speak to them and contact Dr. Mahajan over there. Thank you very much, doctor, for being here. And thank you to the Fortis group for having facilitated this. Just 2 minutes, doctor. I will. So doctor had made an excellent presentation. Those of you who would like to see it can see it on the Seniors Today website on Monday. The edited video as well as the takeaways, which are written by a medical practitioner, will be also put up on the website. So you can take a look at that, go through the presentation once again. If there are some notes that are there, some suggestions that doctor has made, you can take a note of that and benefit from it. Do remember that tomorrow is the finale. I know the cricket match, the India cricket match starts tomorrow, but before that, at 11 o'clock, there is a presentation by, there is the health, there is Seniors Have Challenge, which starts tomorrow at 11 o'clock. So please attend the finale of season 12, which starts at 11 a.m. And otherwise, you do have the connects of all our events, the Evergreen Club, which is there for you to benefit from. Thank you very much, all of you. And we will be back next week, next Saturday at 5 p.m. with another session of Health Live at Seniors Today. We have a special session on arthritis next week, so please be there. Thank you very much.